Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care and healthcare in general. Here's your host, Dr. Hassaballa.
And feel free to interrupt me. So we talk about documentation in T&K and informed consent. Okay, let me tell you something. Litigation is part of the job. Okay, I don't like having to practice with the gun of litigation to my head. I agree with that. At the same time, it's unfortunately part of the job. How you can mitigate that is by documenting thoroughly. And so let me tell you something. If it's not in the record, it did not happen. I don't care if you say, I come every day and I do this every day. It's been part of my practice for 30 years. If it's not in the record, it did not happen. If it's not in the record, it did not happen. So if you don't document that you did a neurological exam, you didn't do a neurological exam, even if you did a neurological exam. But if you don't document it, it didn't happen. I don't care what you think you did or what I do. It's my part of my practice. I'm the doctor. It doesn't matter. If it's not documented, you didn't do it. If you saw the patient at 6:30 in the morning and they were okay, and at 10 a.m. they deteriorate and die, but you don't document, you don't time your note at 6:30 a.m. when you first saw the patient, you didn't see them at 6:30 a.m. But I did. Your note is timed when you wrote it at 2:45 p.m. That's when it says the date of service was. No, but I was there at 6:30. Ask the nurses. It's not in the record. It didn't happen. So Epic, you can change the time. See, there's two times in Epic. There's the file time when you sign the note, and there's the date of service time when you see the patient. I put down the time I see the patient in the date of service. I might write the note 3 hours later. So it might be filed at 9:30. But I saw them at 7:30. And Epic, I love it. They put it in order of when you saw them. It puts it in chronological order, backwards chronological order. So if you see them at 7:30, your note's going to be towards the bottom. If all these other people saw them, you saw them at 7:30, your note will be down there. So yeah, okay. Oh, okay. You saw them at 6:30. Yeah, and when I saw them at 6:30, everything was okay. At 9:30, they suffered cardiac arrest. But at 6:30, when I saw them, everything was okay. It's in my note. It's in my note. But if you didn't document, it didn't happen. And why? I've been sued twice. First time I testified at trial. I was dismissed. I was the intern. I was a 1 month, not even 1 month old doctor. And I was sued here's the case. The case was a lady who did fine. She had a little bit of a headache when she was on the day of discharge, but she was totally okay. She goes home that day. She suffers a seizure. They call the doctor. The doctor says, go to the ER at 7:30. They don't go to the ER until 9:30. She's been seizing this whole time. She comes back to the hospital, gets readmitted, stays in the hospital for 4 months, dies of Stevens-Johnson syndrome 4 months later from the Dilantin that she got from the seizure because she had an intracranial hemorrhage. And they came back and sued me and the attending because we didn't find the subdural hematoma. That was the case. And I went through a deposition for hours and hours, and they kept trying to make me say Coumadin or heparin makes you bleed, and I wouldn't do it. I wouldn't say that. I go, it doesn't make you bleed. It's just if you bleed more. And he kept asking the same question over and over and over again for me to slip up and say it. Well, why are they? I go, well, because again, I think I said, and then my lawyer's like, you've asked that question 10 times. Stop. I'm just like, okay. The lawyer got frustrated because he wants me to say what he wants me to say, and I wouldn't do it. Then they finally dismissed me, but I had to testify at trial. So in trial, in court, by this time though, I'm already third year resident. By the time the trial came, they had, no joke, as tall as this wall, my progress note that they put up on, now it's electronic, that they put up on a board. And they said, doctor, can you explain this? And they went through line by line of the R1 progress note. Though the baby doctor, I wasn't even a month old. Literally, what do you mean by this? And how come, what does this mean? And what does this abbreviation mean? And what does this mean? Line by line in my documentation. And I said, and I explained what this means and what this acronym means and what this abbreviation means and everything like that. Line by line. They went, when I was an expert witness, they went they went through my documentation line by line. On this day you wrote this, and on this day you wrote that. And what did you mean by this? And what did you do by that? But if you don't document it, it doesn't happen. So if you said you did something, but you didn't write it, it didn't happen. And which then brings me to my sermon about copying and pasting. Okay. I don't know what it is about trainees, and I'm sorry to pick on you guys. I don't know what it is about trainees. They take forever to write notes. I don't understand why. We have dot phrases. You have dictation. I can show you how to do in Epic. You can do autocorrect, where 3 characters gives you this long thing. You can make a whole sentence out of 3 little letters. I could teach you all that. Okay? I can do that and make a note that says something different without copying and pasting. And Epic has that little thing there, and it will show you what you wrote and what you copied from the day before. So you don't think they're going to figure that out? Because the point, it's adversarial. The plaintiff's attorney wants to get as much money as possible for the client because that plaintiff attorney gets 30%. So they're going to try to show that you deviated from the standard of care. What's the standard of care? The standard of care is what a reasonable clinician would do in the same clinical situation. That's the standard of care. Okay? A reasonable clinician would do in that situation. So if you copy and paste, they can find that out. So I can easily say, did you even come to work that day? Or did you write your note from home? No, I was there. Yeah, but your entire note is copying and pasted. How do I know you were there? Did you come? No, I was there. But you said he was intubated and sedated, and he was extubated 3 days ago. Right here in the flow sheet, it says that they extubated the patient on Wednesday, but on Friday, you were intubated and sedated. Why'd you do that? Did you even come to the hospital that day? Can you not tell the difference between an intubated and an extubated patient, doctor? What are you going to say? And it makes it all the more reliant on your documentation because the case is going to come to you 5 years later. I don't remember. When I was an outpatient, I remembered every single one of my patients. You tell me the name, I go, oh yeah, she needs a CT scan because the nodule was 2.5 centimeters and I got to get another one in 1 month and I got to do that. But now in the ICU, I see literally hundreds of patients a year. I don't remember. I don't remember. All I have is my documentation. So if your documentation sucks, prepare to have a difficult time. And they can construct the story about you. And if you don't document, you can't refute it. But that's not what you said, doctor. That's not what you wrote. No, but that's what I do. But that's not what you wrote. That's not what you wrote, doctor. That's all you have. And you're not going to, a lot of times you're not going to remember. I was brought into a case. I wasn't even in the hospital. I was off that weekend. I diagnosed the PE. The patient fell, had a brain bleed, and I think passed away. So they came back and they wanted to depose me. And I'm like, I don't know. I wasn't even there. I was off. And they finally dismissed me when they realized that Dr. Hassaballa wasn't even in the hospital when it happened. right? But they went through in the beginning and said, well, but look, here you, and they went through my notes. One by one by one. I had a case where I wrote, so I had a guy come into my office on Tuesday, hypoxic. He walks in with a sat of 70%. Walks in. Happens to me all the time as a pulmonologist. Walks in with a sat of 70%. We put him on oxygen. He feels so much better. And I told him, listen, and I looked at his CAT scan. It's really bad. I told him, you need the bronchoscopy. I can't do it right now. I can't do it today or tomorrow, but you should come to the hospital. We'll admit you to the hospital, put you on fluids, antibiotics, oxygen, and I'll do the bronchoscopy when maybe Thursday, it's Tuesday, maybe Thursday or Friday. No, doctor. I'm fine. I love the oxygen, makes me feel good. Just give me some oxygen. I'll see you on Friday in the outpatient bronchoscopy. I told him, you really should come to the hospital. I don't recommend it. No, please. I told him, you really should come 3 times. And in my office note, I told him, and I made arrows, and I said, I told him 3 times to come to the hospital, and he refused. He said, I'll see you on Friday. Friday comes along. He's way too hypoxic. We cancel the bronchoscopy. We admit him to the ICU. We eventually do the bronchoscopy. He gets eventually diagnosed with blastomycosis and dies. In my bronchoscopy note on Friday, I said, I saw him in the office on Tuesday. He refused admission to the hospital, and he insisted on coming today. After admission on my consult, I saw the patient on Tuesday. He refused admission to the hospital, and he everywhere. He unfortunately passed away. His family was very upset. 1 week later, I'm not joking, I get a letter from a lawyer. I want all your records. I said, okay, go right ahead. And then silence, nothing. Why? I think is because I wrote maybe 5 times in the record, I told him on Tuesday to come to the hospital. I can't force him. I can't arrest him by the cops and force him to admit him to the hospital unless he says I'm going to kill myself. I can't do that. He chose not to go to the hospital. It's not my fault. Had he chosen to come to the hospital sooner, we may have diagnosed this sooner. He may have lived. That would have been the story. I would have said, I told him on Tuesday. He said no, and I documented it in my record by hand. We didn't have EMRs. I wrote it by my hand. We did not have an EMR. I wrote it by my hand. That extra 30 seconds probably, and the Lord's grace, saved me from a lawsuit. And it's very painful. The lawsuit's very painful. I will never forget the first time I was served. My 23-year-old daughter now was in my arms. I held her in my arms. She was a baby. When they walk in, are you Dr. Hassaballa? Yes. Here you go. What's this? Have a nice day. And then I open up, wrongful death. And they made me out to be a murderer. I swear to God, I'll never forget. That was a long time ago. All because of documentation, writing, taking the time to write. That, and it will save you. Another case, a patient, I wanted to check for PE. I told the patient, I said, I wrote in my note, this patient just got contrast. I don't want him to give more contrast because it might cause kidney failure. So I'm ordering a VQ scan. And I order a VQ scan. It was like 4:45 p.m. Next day I come in. Where's Mr. Johnson? Oh, he's in the ICU. Why is he in the ICU? Oh, he got kidney failure. Why do you get kidney failure? Oh, because you got a CT chest. What? So I go to the ICU. The nurse changed my order in my name to CT chest. Did not call me. Did not tell me. The patient got CT chest and got kidney failure. I wrote in the note, I did not authorize the CT chest. No one spoke to me. I called nursing leadership, and that nurse was fired. Again, and what was the first thing they did? Is they read my note. Not the lawyer, the nursing leadership. They read my note. And I explained my thinking of why I'm ordering a VQ scan, because I know probably the nuclear medicine people left for the day and they did not want to come back in. I don't know. They didn't tell me. Had they called me, I would have insisted, nope, I need a VQ scan. If I'm on call, they're on call. They have to come in. I have no sympathy. Zero. If I'm working, they're going to be working too. Patient care is 24 hours. Yeah. Sick people don't take Christmas off. This is our field. I'm blessed to be in this field. I answered the calling. That means I will have to work some holidays. And I have to work some weekends. Yep. Absolutely. But you know what? I'm reading about college graduates that are submitting 500 applications and not getting one response. And as a doctor, I can walk out right now and work anywhere I want in the world. That's a privilege you have that no one else has. So yeah, does that mean you have to work a weekend or two? Mm-hmm. So what? And I make a good living too. So that's a aside. The first thing they looked was my progress note, my consult, to explain why I ordered a VQ scan. It was clear as day. Wasn't my fault. Documentation. And now there's no excuse. There is absolutely no excuse for copying and pasting. I'm a physician advisor, so I look at retrospective charts later, and I'm looking at days of the note being identical. And I'm angry as the physician reviewer. I'm mad because I can't defend your care because you copy and paste day after day after day. Something has to be different today. The labs are different. Something happened. You have to document differently. And again, you know how long it takes me to do a progress note? 30 seconds, tops. And I don't copy and paste. I don't never copy and paste. I document, I use my dot phrases, I use my autocorrect, and I write an original note every single day. And you know what? I'm out by quitting time. Unless someone comes in at close to quitting time and I have to stay all night, I'm gone by quitting time. I'm not doing notes at home. I want to go play golf with my son. I want to go sit in the pool. You think I'm going to sit in 3 hours writing notes? Hell no. My billing's done. My notes are done. I leave. I'm off. If I come here and work, you better believe I'm going to have dinner reservations at 7:30. You think I'm going to stay here right now? Unless someone comes in at 6:45. I mean, that's different, right? But other than that, you think I'm going to stay later? I want to go have dinner. And I never copy and paste. Not once. Not once. Now, it might be the same. Patient remains critically ill with acute respiratory failure, secondary septic shock. It might be the same. I'm not saying I'm not going to make up new diagnoses. And today he has Guillain-Barré, whereas I'm not going to do that. Okay, I'm not going to lie in the record. It might be the same thing. He remains critically ill. He remains dependent on invasive mechanical ventilation, but something's different. He continues to have anemia. I'm not copying and pasting. And if I can do it, you can do it. There's no excuse. Absolutely no excuse for copying and pasting. And if you do that, there's two things. You copy and paste, you open up yourself for impeachment of your integrity. Did you even show up? How do I know? You can just write your note from home. How do I know you were there? Oh, the nurses saw me. Okay. You want me to bring the nurse and testify? Oh, I saw that. And 5 years later, oh, I don't remember. There you go. That's all because of your documentation. Take the 30 seconds it takes longer to dictate. I can't type anymore. I'm old. I have fat hands and I'm old. I can't type. So I just dictate. I can dictate a humongous thing in 5 seconds. Dictate. Use dot phrases, whatever. That way you're not burned out because you're slow and inefficient. I'm burned out. I'm always going home writing my notes. Well, I'm sorry. Because you know what part of it is? I'm sorry. Being curmudgeon here. Part of it is, in practice, we don't have caps. We don't have service caps. Okay? If I get 12 admissions, I get 12 admissions. That's the way it is. You think I'm going to pay you a $600,000 salary or whatever, and you're just going to work banker hours? Are you serious? Ain't going to happen. In fact, if they flash you an eye-popping salary that's just out of the norm, that's a red flag. That is a red flag. If there are doctors coming out of the woodwork, why do I have to pay a lot of money? Because they like you? Because they're waiting for you to graduate? No one's waiting for you to graduate. And let me end with this. No one is waiting for you to graduate your residency. The world wasn't waiting for me. I thought they were. Right? I came down to unit like, Hassaballa's arrived, y'all. Watch out. And the nurses put me in my place. 4 weeks. And I came out, oh, thank you. My pleasure. Anything I can do for you? They taught me humility. The world was not waiting for me to come out. You are blessed to be here. It is a privilege and an honor and a calling. No one's waiting for you. So when they offer you just out of the norm, something ain't right. Something's not right. You're not just going to waltz in and make, $1 million and work 9 to 5. It ain't going to happen. Unless you're a CEO of a company. You're not. It costs a lot of money to bring on a doc, to credential and license and get them on staff and get all the insurance companies. And then you're not earning revenue for 6 months because that takes time. You're not earning revenue. So I'm paying all this out of my pocket. And if you have a doctor who's your boss, maybe that doctor will remember what it's like I do. Or maybe that doctor works clinical like I do. More than likely, you'll have a business person who doesn't care about you or your path or how hard it was or how many hours you spent or how difficult it was or how hard was it getting to medical school and how many holidays you worked, how many weekends you worked. They don't care. They're off all the weekends. All they see is, I don't understand, doctor. Everyone else can see 10, 15 patients in half a clinic. Why are you only seeing 5? Well, I'm taking my time and I'm talking to my patient. It doesn't matter. We're losing money on you. You either pick up the pace or we'll see you later. So figure out how to be efficient without cutting corners. Figure out how to document appropriately without copying and pasting. It's very, very doable. So that when you're done, you go home. Because most of our jobs are going to be shift work. Even outpatient. You have your day. And yeah, they're going to cram in people because they want to make as much money as possible. Yes. They need to recoup their investment. It's a business at the end of the day. So, and when people complain, oh my God, so hard. I had to stay 2 hours later and they ask for extra hours. You know what we do? Me. I look at their numbers. You only saw 11 people in a 12-hour shift. What do you mean it was hard? Oh, no, that doesn't reflect how hard it was. Really? So I come down and I work. And my 3-night average is more than that guy's 3-month average. And I wasn't even working that hard. And that's a clinician boss. But if you have a finance boss, they could care less. Trust me. Because I've had finance bosses. They don't care. They don't care how hard you've worked. They're off on the weekends. They're off on Christmas. They're off on New Year's. They're off on Easter. They're off every single holiday while I'm working. So don't give your adversary the knife with which to stab you. And take the extra 30 seconds it takes to document appropriately your thought process. What do I think this patient has? And what am I going to do about it? And what do I think this patient doesn't have? And I do it in narrative form, in paragraph. And I hate the system. I can't stand the system. Patient has septic shock, and I have to wait until ID to get to the. What does the patient have? Neuro, awaken alert. Cardiovascular, shock. Pulmonary, breathing okay. GI, I have some stomach pain. And I go ID. Oh, they have septic shock? Oh, is that what the problem? Come on, y'all, just tell me they have septic shock. I hate the system. I hate it. I hate it with all my being. Yeah, you're thorough. You go through every system, but I want to know. When I look at your note, again, I have time. I have things to do. When I look at your note, I want to know what's going on with the patient and what am I doing about it. And you know what? Don't make me scroll to the bottom. You ever notice my notes? My assessment's on the very top. I don't care what your physical exam was. I don't care. I don't. I don't care what your the lungs sounded like. I don't care. I want to know, especially if you're a specialist. If I consulted you, I want to know what you think is going on with the patient, and then how you're going to help my patient. So I say right at the top, the patient is critically ill with acute respiratory failure secondary to bilateral pneumonia causing ARDS. The patient is dependent on invasive mechanical ventilations. Period. The patient also has septic shock on vasopressors. Here's my plan. I'm continuing. The patient is too hemodynamically unstable for safe extubation. I'm continuing vent support. I'm continuing titrate propyl fentanyl. I'm titrating norepinephrine with fixed dose vasopressin. I'm continuing antibiotics. I'm giving them heparin for DVT prophylaxis. They are not candidates for enteral feeding. They're on mobility protocol. Thank you. Sign. That's it. Everyone knows right there when I see what I think is going on and what I'm doing about it for today and tomorrow. They might be the same, but I'm not copying my note from yesterday, and it takes me 30 seconds to write a note. Don't do that. Don't do that. It's all about your documentation, about what you write down. I can't so forceful about it because I've been there and I've been in depositions, and all they do is go over what you wrote. And if there's gaps in your documentation or you copy and paste, prepare to have a difficult time, because they're going to construct a narrative about you that may not be true. But because you didn't explain or you took a shortcut, then all you're doing is opening yourself up for pain. And it's very, very painful. It's very difficult. There are some doctors who've committed suicide because of litigation. It's a big deal. So, and it all rests on you and your documentation. It's in your hands. And again, that guy that died of blasto, all it took was literally 30 seconds more writing with my hand. That saved me from a lawsuit, because I knew the family was angry. And like I said, I got the lawyer letter the week later. He may not even been buried yet. The lawyer asked me for all of my office records, and I had nothing to hide. Here you go. Even dating and timing could save you from a lawsuit. Well, Dr. Mormon saw them at 6:30 in the morning. But Dr. Wynn, she didn't come until 3 o'clock after it was all done. No, but Dr. Wynn, she saw him. She was there at 9. She didn't write that. I'm picking you guys. That's all they have. So I can't stress it enough. You have to take the time. And when you take the time, you come across as a very thoughtful clinician. Thoughtful clinician, you care about the patient, and I'm sure you are. That you care and you're really thinking about it and you're doing the best you can. We can't always have good outcomes. There are sometimes bad outcomes. But if you are thoughtful, you did the best you could, you helped as hard as you can, sometimes people don't have good outcomes. But then you don't give them the opportunity to blame you when it's not fair to blame you. Sometimes there's nothing I can do. But if you cut corners, then all bets are off. Questions? Document. I can't stress enough. And never copy and paste. Because we can tell. Even if I change my note, if I want to add more critical care time, they have a revision history. They can see. Oh, the other thing I've done, never, ever, ever change a note 3 days later. You might as well open up the checkbook. They can tell. Never. Someone codes, and then you go back and you say, on the day that they coded, you put the note in, you put something else in, you change your note. Not later, a couple hours later. I'm talking about a couple of days later, a week later, a month later. You do that, you're dead in the water. Now you're falsifying records. Again, I don't know what this like. It seems like residents, or trainees, have to have everything in the note that happened that day. You don't have to. That's what an addendum is for. So at the time you saw the patient, this is what you're doing, and then later they deteriorate. Write another note. Write another note, an addendum. Called back to the bedside because the patient had rapid atrial fibrillation. I did this. Later on, no problem. You don't have to do a brand new progress note with all the templates and no, just a blurb. This is what happened, and then maybe an hour later, another blurb. So what? But you go back after the fact and change. Oh man, That makes me shudder. Because now you're falsifying the record. Why are you doing that? What are you trying to hide? Oh my God, I can't even imagine. Please, I don't want any of you to go through the pain of litigation. It may end up happening, but if your documentation is solid, you have nothing to worry about. All we do is do the best we can. The outcome is not in our hand, but we work hard. We work the hardest we can for our patients. And you just have to show the world in your writing what you did. And by that and that doesn't mean that we'll never get sued ever. No, that may not be. But then you can defend. I did the best I could. I came in at 7 a.m. I saw them right away. This is what I did. Unfortunately, it didn't work. And then that's it. That's all you can do. And then people will see that this doctor really does care. That's in your hands and your keyboards and your dictaphones. Questions? All right. Thanks for your attention. Appreciate you guys. Thank you for listening. To get every episode delivered directly to your inbox, please subscribe at healthcaremusings.com.